I'd like to welcome everybody to today's workshop, Demographic and Health Data for Central Oregon, Where to Look. My name is Lisa Schoblum, and I'm a community librarian with the Deschutes Public Library. Joining me today is my colleague, Ria Fenewald, who will be recording the session and monitoring the chat for questions. We have muted everyone and turned off your cameras. If you have any questions, please put them into the chat. As I mentioned, we are recording today's session for later viewing on the library's YouTube channel. Let's get started. It is my pleasure to introduce our first speaker, Rebecca Berry, the Grants and Metrics Manager for the Central Oregon Health Council. Welcome, Rebecca.
Thank you so much, Lisa. Well, welcome everyone. My name is Rebecca Berry, as Lisa mentioned, and I work at the Central Oregon Health Council. And we're so happy to be here with you today. So we're excited to introduce you to the Central Oregon Health Data Site. This site is financially sponsored by the Central Oregon Health Council, but we also have an amazing team of people working to improve and maintain it every day. Their organization's generosity in donating staff time to this project is priceless. I'd like to thank Crook, Deschutes, and Jefferson County Public Health Departments, OHSU Community Research Hub, and Conduent Healthy Communities Institute for their efforts towards this project. The launch of the Central Oregon Health Data Site offers a way for people to access data that's updated at least yearly. It's completely free, it's all online, and new data points are being added often. So we're going to give you a quick tour, but before we begin, in the chat feature, could you please answer a question? So this question is on a scale of 1 to 10, 1 being least familiar, 10 being most familiar. How familiar are you with the Central Oregon Health Data Site so far? Okay, great. So we're going to just take a look at those as they're coming in, but we're going to continue along. So right on your screen, you see your tour guide team today. And so you've already met me, Rebecca Berry, so I'm going to allow Shanna to introduce herself.
Hi, I'm Shanna Lindsay. I'm the Quality Improvement Analyst with Deschutes County Health Services, Public Health, and I'll turn it over to Sarah.
Hi, I'm Sarah Michelini, and I'm the Central Oregon Liaison for the OHSU Community Research Hub. And then I will turn it over to Kelsey.
Hi, I'm Kelsey Seymour. I am the Administrative Assistant and Media Coordinator at the Central Oregon Health Council. Kara?
Hi, I'm Kara Woodard, and I'm a Senior Account Manager at Conduent Healthy Communities Institute, and our organization runs the back end of the data website.
Thank you all. So we have a quick agenda to share with you. This is what we'll be going through on the webinar today. Throughout the time that we have together, anytime you have questions, feel free to put them in the chat chat feature, and we'll keep track of those and make sure that we get to them at the question and answer section at the end. So we're going to do a data overview of what's on the site. We'll talk a little bit about different applications that the site can be used for. Kara is going to take us through a great site tour. We're going to talk about some next steps, and then there's some time for questions and answers at the end. But before we dive into that, I have one more question I'm hoping that you could answer in the chat feature. So please write what topic you might be most interested in learning about today in the Community Health Data Site. And as you're putting that in the chat, we'll move forward with the presentation. So the site, Central Oregon Health Data, launched in September of 2020. There are a number of geographies covered. So the state of Oregon, Crook, Deschutes, and Jefferson counties. There are 20 census places, 20 zip codes, 35 census tracts, 3 zip codes and 1 census tract in northern Klamath County as well, And overall, there's 79 locations that people can search for health data for. There are 341 different measures, health-related measures on the Central Oregon data site, and those are completely separate from the demographic data, which we'll be discussing later. So Central Oregon health data is a way to monitor community health improvement, and it can be used in a variety of ways. So it can be an analysis tool, a report builder, a data center, a way to track progress on particular health indicators. There's even an events calendar to look to see what's going on that's health related in our region. It's a research tool, which can really help with helping to find data to write for grants. It's a comparison tool. We can look up different types of best practices. It's a source for funding opportunities. So there's an opportunity to look for funding on the site. It can help serve as a map for underserved or under-resourced areas. And it's a decision-making tool for future projects and investments. So this site keeps data from becoming immediately outdated, and it's a real-time living document. And over time, we've started adding storytelling data or qualitative data on the site, but over time, we're going to continue to add that so people who are looking at the site can consider community voices and perspectives when they're making decisions. All right, I'm going to turn it over to Shanna now.
Hi, I'm going to give a quick overview of the indicators, measures, and data on our site. So we do have both health and quality of life measures. The data is publicly available from state and national sources, and it's reported at a county level, so across the region and across census tracts in some cases, which is really incredible. The data is valid and from really reliable sources. It uses appropriate methodology and sample sizes so that we know the data is reliable when we use it. There is a high likelihood that an indicator will be replicated in the future, which means that you'll be able to look at changes and metrics over time. And it is generally consistent across counties so that we can look and compare between Central Oregon counties and other regions. And it does align with our goals for health improvement as a nation. And so that would be like our Healthy People 2020 and Healthy People 2030 objectives. We do have 33 measures that are managed by Conduent and 22 that are managed locally. And so that means we can add new data to the site to meet our community's needs. And that's something we're always looking for. So let us know if you have ideas. Examples of where our data comes from includes like the Center for Disease Control and Prevention, county health rankings, the Environmental Protection Agency, the Oregon Healthy Teen Survey, and many, many others. We also have demographic data on Claritas, which is the next slide, and includes 250 elements that we can view at the state, county, and zip code level. It includes things like population and housing, economics, and other occupation data. Claritas pulls estimates using the US Census and the American Community Survey so that we can look at that data more frequently, which is also a really helpful tool. So with that, I'll go ahead and turn it over around how you can use this data.
Great. Let's discuss how you can use this data. Community uses, you can use it to perform assessments, for writing scholarly reports, for finding funding opportunities, sourcing data to support grant applications, identifying promising practices, which we'll fill you in on in a bit, tracking measures, and finding opportunities to collaborate. Let's go online and we'll show you what we're talking about. I'm going to hand it over to Kara.
Thanks, Sarah. Great, so here we are at Central Oregon Health Data, found at centraloregonhealthdata.org. And at the website, we have community health data to drive decision-making. So first, we'll see an overview of the navigation and features on the site before we jump into the data. But we can learn about the overall health of Central Oregon through the regional health assessments, which you can find here. as well as the regional health improvement plans, which are created every so often. And from that, we have 6 different priority areas. So this is currently what the group is tracking. And within each of these pages, you can learn more about the measures being tracked, the current data, and the goal. Under community projects, there's a section called What We're Learning. And this features projects that were funded from current and past regional health improvement plan priority areas. So if we scroll down, we can see we've got quite a number so far. And within these projects, I'll click into Dawn's house. We can learn more about when the project took place, what it is, who was involved, our projects and organizations, what we wanted to accomplish with this project, and then any project outcomes, as well as successes and challenges, and key highlights. So this is a collection that will continue to grow under What We're Learning, so make sure to check back often. All right, under resources and events, we have a community calendar. This highlights local health and quality of life related events. So we'd love to have your community calendar input. So please read our guidelines and make sure that they apply, but we'd really like to make this a community event. So if there's anything you'd like to add to the calendar, please reach out. And there's an email right here to add your event. Also up here at the top, we have a link to a collection of national and state funding sources under funding opportunities. And this is a collection of national and local grants that our research team maintains and develops. So up at the top, we have our local funding opportunities. So what's going on here in Central Oregon. And then we have our national funding opportunities. You can use our search filter to narrow down your parameters. Now we're looking at all of the resource library. And then within the funding opportunities, they should only be current funding opportunities. So these opportunities should have the grant period currently open. So once the funding opportunity closes, it should disappear from the site, and then new ones will always be reappearing. So say you work in children's health and you're looking for grant funding, we can click on the W.K. Kellogg Foundation and get more information about how to apply for their grant here. So the funding opportunities, as we saw a sneak preview of a moment ago, are housed in the resource library, which you can access here or under resources and events, under resources and links. And the resource library is an opportunity to find resources that the Central Oregon Health Data team has uploaded to share with the community. So you can search for resources using the search bar, our filter box here. So you can do a keyword search, or you can search by resource type. So say I want to see particularly videos or webinars to learn more about a particular subject. We also have mapped collection, which you can look at under here under Explore Our Collections. So say I want to learn more about blood pressure resources or tobacco. But if we click our substance use disorder resources map, we can see these are mapped here in a collection. So I'm looking for treatment or care for this issue. I can find different community organizations that are working here. And if you click into each one, it tells us more about how to contact this organization, services offered, payment options, age groups, and then we have another map as well. Down here at the bottom, we have related content for our organization. So if we are looking at substance use disorder, we have related indicators, related promising practices, other community resources, funding opportunities. So everything within the site will always tie back to each other. All right, also back here at the top, we have our promising practices. So the promising practices module is a collection of programs geared towards improving community health that have shown to be effective. There's over 2,300 promising practices in the database. when you can search the database by keyword term, ranking, target audience, topic and subtopic, or geographic type. And with regards to rank, there's 3 different ranks. So an evidence-based practice is the gold standard. It's something that's been shown to be statistically significant, peer-reviewed, replicated, and evaluated. And our effective practice has been evaluated, but maybe not shown to be statistically significant. And a good idea is a good idea. So maybe there's not enough time or resources to evaluate it yet, but it's an undisputed good practice. So to search our different promising practices, let's say we're looking for programs for obesity. So I can see that my 22,000 plus programs have been narrowed down to 170, but that's still a good amount to look through. So say I'm really looking for obesity in children, I can narrow down further and see what programs are out there. So now I'm down to 101. I can save a link to this search here. So I can share that with a friend or put it in a report. But over here on the left are our actual programs. So it tells us the title of it. If it's a CDC program, it'll come with this little CDC tag. But let's jump into Bienestar. So here we have our indicator name, its ranking, the description, goal or mission, its impact, results and accomplishments, and more about this promising practice. So we'll include the original person or organization that ran this program, as well as any contact information, websites, so you can learn more and contact them directly. And again, our related content underneath. Up here at the top right, we can jump to another related content, related promising practice, and search that way. Jumping back one, if there's any programs going on in the community, you can also submit a local promising practice so we can learn more about what you're doing locally that's been successful. All right, back to our homepage. So now that you've seen a few resources, you may be wondering, how can I get started? So there's a section on the site to learn more about the different elements, as well as guides on how to search for data. So after our immunization spotlight, our COVID-19 info, down here there's a section, how do I get started? So within here, if you click on these Expando tiles, there's resources within that link you within the website. So while I'm here, I can browse data, discover those funding opportunities, explore what we're learning, or we have a whole video tutorial embedded here about the whole website. Jumping to specific activities, how can I view the data? Hopefully this will help kind of jump you to where you need to be. How do I download data? And we'll go over all of this in a moment live. How can I build a dashboard? A short dashboard tutorial, and how can I build a printable report? So these are great resources to come back to as you're getting more familiar with the website and how to use it. Okay, so about that data, let's jump back up to the top. Our first resource that we'll visit is the Socio Needs Index. And to get there, I'm going to go to Search for Data, and then scroll down to the Socio Needs Index. And this is a tool that helps to measure socioeconomic need that is correlated with poor health outcomes by combining multiple indicators into a single composite value. As a single indicator, the index can serve as a concise way to explain which areas are of highest need and why you may need to focus your efforts on those areas. So all zip codes in the United States are given an index value from 0, low need, to 100, high need. Zip codes are then ranked from 1 to 5 based on their index value, color-coded and displayed on an interactive map, as well as the bar chart. So we can see that those dark-colored areas are 5s and are our areas of greatest need within Central Oregon. So many clients use this tool in their grant application process to see these zip codes are in particular high levels of need. And actually, we have this data available by census tract as well. So if we change our locale here, we can then drill down even more and see those other areas of great need. So I can zoom in. And what we can also do is say my organization only covers a certain county. I can look at a county within Central Oregon, and it will recalculate that. Each time you're on the site and you see a map, you can export the map. So let's zoom in to just Deschutes County. We can turn on labels here. So we've got our zip codes. And then by clicking this button, we'll export your map. Similarly, down here, each time you see the 3-line icon, you can download that chart. And you can download a CSV file of the raw data. So this is the Socio Needs Index. Jumping back here, we've recently released a Food Insecurity Index, laid out fairly similarly to the Socio Needs Index. And this is a measure of food access that is correlated with economic and household hardship. So darker areas on the map are areas that have higher food insecurity. So again, this data is also available by zip code and census tract. So this is our Food Insecurity Index. All right, so to see measure data for the region, navigate to Explore Data, and then search for data. So we were here a moment ago, but this is our dashboard landing page. And this is a launch point to any dashboard, indicator, or measure that you'd like to view. So from here, you can build a custom dashboard up here at the top right, where you can do a detailed search and save your results. You can search by keyword by typing directly in the search box. So say I'm looking for cancer data. And then I hit enter. Then it would give me all related cancer indicators. So I can jump to the indicator that I'm interested in, or I can X out those I'm not and show the rest on a dashboard. You can search for indicator using the drop-down menu on our left here. And the way the indicators are laid out is that all the health data is first, and then our other topics and subtopics. Our subtopics are alphabetical order within. So first we have our health, adolescent health, health, alcohol and drug use, health, alternative medicine, health, cancer. You can also type in here to jump to an indicator. Or you can use a location menu to look for data. So all locales on the site start biggest to lowest to smallest. So we have our state, our region, our county, and then our census places, which you can think of as cities, and then zip codes and census tracts. Or you can search by map. If you click this little pinpoint, it will pull up a map. And say for interests, for example, I don't know what census tract I live in. We could use the map to figure that out and jump to data for that locale. Or from this page, you can jump to a pre-built dashboard. So I'm going to go through a few of these here below. First, we'll have a look at the All Data dashboard. And the All Data dashboard has all the data on the site at all locales. So again, it's going to start with the state, but we can jump to any locale we'd like. So let's look at Jefferson County, and then it will reload. And again, all of that health data shows up first, and then we can scroll down for that education, economic. So the way the dashboards are laid out is we have our indicator name, the value, the time period, and then all available comparisons. And depending on the indicator, will depend on what comparisons are available. And to learn more about each of those comparisons, we have a legend here on the left that pops in and out. So here we can learn about these different gauges and icons. And if I click on the I button, that will take us to the Help Center where we can learn even more. So right now, this is the gauge and icon overview page where we can learn about these and download a copy of them. But also while you're here at the Help Center, you can search for anything using the search bar or from the general homepage. So if you want to learn about other data on the site, you can do that at the Help Center. All right, jumping back. So again, this is all data, so it will scroll down for quite some time. And I can use this orange arrow button to jump back to the top. Right now, what we're looking at is our standard dashboard or condensed view. We have a neat feature that turns on what we call card view if you click on this icon here. And what that does is it takes each of those indicators and it turns it into a downloadable graphic. So if you click on Save Card, it'll take that graphic and save it as a JPEG. So you can easily put all that information right into a report or a presentation. So that's super helpful. We also have colorblind mode. And what that does, it will give a thumbs up or a thumbs down next to those indicators that may be difficult to ascertain if you have trouble seeing in color or perhaps you're printing in grayscale. So that's another feature that you can turn on and off. All right, so that's the all data dashboard. Jumping back to our dashboard landing page. The next one we'll have a look at is our disparities dashboard. And this dashboard has all indicators that have breakout data. So typically this will be race, ethnicity, age, and gender. And you'll see a few different colors here on some of the breakout bars. So when we see green and red, that means this subgroup data is statistically different than the overall value. So in this case, females are less likely to binge drink than males. So as I scroll down, if we have gray bars, that means the source did not include confidence intervals, but we can still see that subgroup data. And then if we have blue bars, that means there's no significant difference in the subgroup from the overall value. So here on the disparities dashboard, again, each time you see this 3-line icon means that we can separately download and save that graph and chart. But it's a great way to see kind of how different populations are doing within each indicator. All right, so that's our disparities dashboard. Just going to jump up here back to our dashboard landing page. And next we'll have a look at the Healthy People 2030 Progress Tracker. And this dashboard, we highlight all indicators on the site that have an HP 2030 target. So this icon indicates whether or not the targets have been met, so you can see how your community compares to these national benchmarks. So again, we can look at any locale. If you look at the city of Bend, we can see some of these were met back in HP 2020, and some we're still working on for 2030, next round. All right. Also back on our dashboard landing page, we have our indicator list by location, which can be found here. And this is a great list of all indicators on the site and at what locale they're available. So for instance, our adolescent health indicators are available at the state and the county. Alcohol and drug use, we have adults who binge drink. We have this available at census place, zip code, and census tract. You can also use this dashboard to jump to data for a particular locale. So say I want to see cervical cancer screening by zip code, I can click on this arrow and it will tell me more about that data. Jumping back up, you can also download this list, and this is a great way to see all the data on the site in one big CSV file. Okay, also back on our dashboard landing page, we have our RIP dashboards. So there's a dashboard tracking the current regional health improvement plan measures as well as the past one, so we can see how the community is doing relative to its goals. And just really quick, each measure in here has an associated target value for either Central Oregon as a whole or by county. So for instance, graduation rates, and then Crook has its own Crook target, and Deschutes has its own Deschutes target. So those are the values we're trying to reach. All right, so those are some of the pre-built dashboards that you can explore. To do your own search and custom view of the data, we'd go back up here to build a custom dashboard. And this takes you to our search tool. And there's two ways you can operate the search. There's a handpicked search or a filter search. So what we're looking at right now is handpicked. So if I want to go to a particular indicator, I can do so here and pull out a couple of them to look at side by side. But if you click on filter indicators, we can filter by all these different parameters to find data. So for instance, I can use the map view and select my locale, or I can include, say, all Crook zip codes or all Deschutes census tracts and have them fill out. I can filter by topic area. So these are all of our topics and subtopics. So say I want to see tobacco data or women's health, or I can use this arrow to include all topics from a topic area. So for our search, let's do all education topics. Let's look at Deschutes and Jefferson County. You can also filter by populations. So if you're looking for data, say for older adults or for teenagers, we can pull that out. Each indicator on the site is classified. So is this measuring clinical care, a health behavior, a health outcome, a health status, or a physical or social determinant of health? And within your dashboard search, you can choose to turn on particular comparisons. So by default, everything that's available will show up. But for our example, I'm going to turn on just Oregon state value, prior value, and our trend over time. So we can just see those three if they're available. And then we have subgroup data. So those were those breakout charts we saw earlier with different colors. So if we wanted to see any of that, if it were available, we'd turn that on. And this is one of the places that you can see all the different sources on the site. So when Shanna called out earlier, we have, I think, 55 current sources on the site. This is where you can see what's involved in the platform. So these are our local, national, and state data sources. Okay, and when you're using this tool, you want to make sure that you don't put in too many options the first time because that might cancel each other out. So right now we're looking for data for these two counties, all education indicators on the site, and we just want to see these three comparisons. So I'm going to click search. Great, and before I scroll down, up here under search results, there's a link that says save a link to this search. And this URL will always remain the same even as the data updates. So you can save the search for later, you can put it in a report, send to a colleague. All right, so as I scroll down, we're looking at education data within educational attainment subgroup. Here we have people 25 plus with a bachelor's degree or higher, Deschutes County, Jefferson County. And I just picked out these three comparisons. So how is this county doing compared to the Oregon state value, the prior value, and how is it trending? So not every indicator will have the trend available. We need at least 4 time periods to calculate that. But it's really great to see in this kind of quick view. So as I scroll down, where are we seeing green? Where are we seeing red? What's going up? What's going down? So this is all the education data we have currently on the site. So student to teacher ratio, proficiency data, as well as our graduation rates, dropouts. So this is our dashboard view. To learn more about a particular indicator, we can click into it. So let's have a look at people 25 plus with a bachelor's degree or higher in Jefferson County. So when I click into this, it takes us to our indicator detail page. And each indicator on the site has a similar looking page. We have our indicator name up top, our locale, and our measurement period. So we'll always be looking at the most recent measurement period, but you could jump back in time as well. And then you can also use these arrows to change your data. And then we have our, what is this indicator and why is it important? To provide a little context about our indicator. As I scroll down, We can see we're looking at Jefferson County, and our rate is 19.4 for this time period of people 25 plus with a bachelor's degree or higher. Our original source is the American Community Survey. This was just updated last month. And then over here on the right, we have each of our available comparisons. So how is Jefferson County doing compared to other Oregon counties in a distribution? And when you hover over, it tells you those distribution values. It's based on data from 36 Oregon counties. It provides a little bit of extra context. And then below that, we have our change over time graph. So each of our indicators with more than one time period will show you how we're doing over time. When you hover over, it'll show you confidence intervals if available. And if you really want to see those confidence intervals, you can turn them on the chart here. So you can see that manipulate a little bit. And then also up here, you can turn on a zero-based y-axis. So if you want your chart to start at 0 rather than 10 as it does now, we can do that. So you can manipulate the graph a little bit and then download in a JPEG, PDF, or the raw data. When there's breakout data available, it'll show up in a bar chart underneath the change over time chart. So it says over here, we have subgroup data available by age, gender, and race ethnicity. So let's turn those on. And we can see that the younger group is less likely to have a bachelor's degree. No significant difference between females and males. And fewer American Indians or Alaska Natives with a bachelor's degree in Jefferson County. As I keep scrolling, each of our indicators are mapped. So let's jump out a little bit. So our first view, since we're looking at a county, is to compare Jefferson County against the other 2 counties in Central Oregon. Lowest value to highest value, and then dark being not as good. So in this case, we want more people to have a bachelor's degree. We can change our comparison under here. So say we want to look at these 3 counties compared to the Oregon state value. So we can see that Jefferson and Crook are below the Oregon state value of 33.7, but Deschutes is above it. We can also see that this indicator has a number of different locales available. So say I want to look at zip codes. It will reload my page. And what it's going to do is it's going to show all zip codes within Central Oregon. But I can use this filter up here if I want to filter just within a particular county zip codes. All right, so now we're looking at all zip codes compared to one another. And again, I can change my comparison here. Say we want to see the trend over time. We can see that this zip code is in particularly trending downward because there's 0. If I click on a particular zip code, we can learn more about who lives in that zip code by clicking on this icon, and that will take us to the demographic page. So this is our Claritas demographics module. And in here we have demographics for the state, the Central Oregon region, the 3 counties, the partial county of Northern Klamath, so that's the 3 zip codes, as well as zip codes within Central Oregon. So right now we're looking at zip 97756. And this is our summary page. So it just takes kind of highlights from population, race, ethnicity, age. And what it does is the system will create a pie chart or a bar chart when available, and then you can download and save that up here. So it creates those great visuals. And when you're looking at zip code data, what it will do is it will compare your zip code to the county it's in, as well as the state. So both by raw number and percent of population. So population by age group, by sex, households, families. If we jump up here, you can dive into more about households' income or housing by clicking on these. And then at the very top, we can view all demographic variables. And that's the list of the 250 different demographic variables. So they're organized in order here so that all the population comes first, then the race, ethnicity, age. You can also use this to jump to data for that locale. So say we want to look at the non-Hispanic white population by zip code. I can jump over here and it will map that data as well. And it shows us both the number and the percent. So we can see that our zip codes are pretty well even here. And then we have that raw data down here. So that is the demographic dashboard. All right, so our newest tool offers an easy way to bring all the data on the site together into an easily downloadable report. And you can do that under Explore Data, Build a Report. And with a location report builder, you can build a report around a particular location. So that's our step one, is to select our locale. And you can build a report around any location, and then data will show up that's available for that location. So say when we build a report around Deschutes County, first it will fill in where I am, and then we choose the different components that we want to add to our report. So if I click indicators, it searches by keyword. If I type in poverty, it'll tell me all the related indicators. I'll select children living below poverty level. And these are the different components I can add to my report. And if you hover over, it'll give you a little snapshot of what that would look like. So I'm just going to select a couple real quick. Charts, gauges, indicator card, there's maps, tables. And then you can include the source, the what is this indicator text, why is it important, and the measurement period for the data. Then I'll click add. And what it does is it works on a grid basis. So although I added all of this, I can easily manipulate it by dragging it and moving it. And then when I want to add more content, I can go back up to the top and continue to add more content. So just move that over there. So it's a really quick and easy way to build, a 1 or 2 pager. We have our tutorial visit here. And then you can click the Save button and then export it as a PDF. Okay, so I know we went through a lot in a short amount of time, and I think there's a few questions that came in. But I'm going to pass it back to Sarah for a moment, and then we will get to questions.
All right, well, we can talk about some next steps. What can you do? You can use this site. You can suggest curated dashboards. You can contribute to local resources. You can consider adding local data. You can provide relevant content. You can definitely share your thoughts with us, and you can share this site with others in your organization or community. And you'll see up on the screen there's an area where you can contact us and let us know your thoughts. One question I wanted to ask everyone here, and you can put your answer in the chat, please. What do you think you will use the site for most?
All right, we have 15 minutes left to go over some Q&A. A couple of you, thank you so much for putting in your topics that you wanted to learn about the most today. One of those was actually really fascinating. There was a question about literacy levels, and I'd love to start there. Rebecca, I know that you had some ideas about literacy and how that's tracked on our site. And once you've exhausted what you know, I'd love to ask Kara what she thinks.
Sounds good. Thanks, Kels. So actually, Kara created a great dashboard in her overview that showed some current measures or indicators on our site around literacy. This is definitely an area that I think we have an opportunity to expand upon. So right now we have letter name recognition at kindergarten readiness. We have 3rd grade reading proficiency. We have 8th grade reading. And then we also have educational attainment measures on the site. But if there are other literacy sources that we could add, we would be so happy to do that. So let us know and we can explore that with you. Kara, do you have anything else to add?
I do. In fact, one of the other clients I work with is Baton Rouge City CLE, and they actually are the library. So they're the East Baton Rouge Parish Library. So they sponsor the website. So there's a lot of reading related information on here, but I just added some literacy data for them. So if we go to their community dashboard landing page and search by literacy. So we just recently added adult literacy and adult numeracy. So I'll click into this one. And this is from a national source they pointed me to. So there are 3 different levels of literacy and numeracy. Just one time period available from this, but it came from this source. So you guys may be more familiar with this than me, but this was a national source of state and county indicators of adult literacy and numeracy. So if this would be helpful to add to Central Oregon health data, that's something we can look into adding.
Pardon my ignorance, but the word numeracy, that's a new one for me. What exactly does that measure?
Great question. So when you look on our numeracy, it tells us what the different levels are. So in this case, at or below level 1 is the lowest. So it says adults at this upper end can understand how to add, subtract, multiply, divide, and can perform basic one-step mathematical operations, i.e. calculate how many bottles of soda are in a full box when only the top level can be seen. So kind of more basic. And then it tells you at your different levels kind of what understanding of numeracy or math that we're at.
Thank you. That's fascinating. I'm watching the chat box for any additional questions. I want to make sure that for those of you who are really interested in the maps for areas of need in our community, that the Socio Needs Index and the Food Security Index are what you meant by that. If you have more questions or thoughts, put them in the chat and we can talk about those. But I think those mostly addressed what you were after. Love what you're going to use the site for: grant applications, finding resources, trends over time, and startups. Very cool. We've had a couple, well, you guys are thinking of more questions that you want to ask. I know it's a lot, and it's kind of hard to know what you want to ask until a couple days from now when you've actually had a chance to take it for a spin. Some of the questions that have been asked at previous presentations that we've done that I found particularly useful, I have a list of those. My favorite one is our site available in other languages? Kara, do you mind?
Yes. So if perchance Mongolian is the language you speak, we can accommodate you. So you will notice that the navigation has changed languages. And some of these are images, so this one didn't translate. But we currently have Mongolian and Spanish set up, which you can get to in the upper right-hand corner of the website using the Google Translate feature. If there's other common languages in the community that perhaps we're not aware of, we can certainly look to add those as well.
Awesome. And for those of you who think that Mongolian seems a little random, we have a public health employee who deals with data up in Jefferson County whose native language is Mongolian. So Kara's company Conduit did that language just for us, which is very cool. Let's see. One of the questions that came up a lot a while ago was, will there be a section of the site in the future that is dedicated just to COVID? Shanna, do you mind talking about that for just a moment?
Yeah, of course. So we actually have a ton of community resources around COVID-19. So you can see we're already kind of on the home screen where it says click here for Central Oregon COVID-19 data. And if you select that, it will take you to a list of the incredible and robust COVID-19 resources we have. So instead of recreating the wheel, since a lot of these exist, we really decided to just make a one-stop shop for everyone to come to find those different resources and the information they might want around COVID-19. So we encourage you to come here and check out some of these different links.
Thanks, Jana. What about the 2020 census data? We all just went through that big push last year. Where are those numbers at? I'm super eager for this stuff, even though I know it takes a very long time. Kara, can you chime in about that?
Sure, it will still be probably 2 more years, unfortunately. So we just released and published on the site the 2015 to 2019 American Community Survey, which comes in part from census data. And that was the most recent. So I would expect within the next 2 years. But unfortunately, it comes from the government and it takes a long time to massage before it's released publicly. But hopefully sooner.
Thank you.
But I would like to chime in on that. I'm one of the census data affiliates for the state through the Population Research Center, and the data does lag, but the better data with all of these different indicators really comes from the American Community Survey, because the decennial census, all it does is count people. It doesn't go into all of those other details. So that's something to know about that, is that American Community Survey data is really the really good data to use.
Thank you, Lisa. And we can jump to that by going to build a dashboard and then filter by sources and see that data.
Very cool.
And what's great about the ACS data is that we have it down to the census tract level as well, so you can get really granular.
Rebecca, I was wondering if you could talk about some of the local data sources that we have included since launching the site last year. Just high level, just a couple examples.
Okay, because I could just go all day with those examples. So when we launched the site, really what helped to guide what additional measures and indicators we added to the site, we actually started with the Regional Health Improvement Plan. And so this is a plan that is collaborated through multiple different organizations in the entire region. They come together, they decide on the priorities that they'd like to improve throughout the region. And so we actually took a look at the indicators within that health improvement plan and overlaid those with the ones that are currently on the site, and the ones that we didn't see, we really wanted to add those into the site. And so some examples of those are some measures around housing choice vouchers. So folks who receive a housing choice voucher to help them rent or own a home or an apartment, actually being able to successfully use that voucher. That's an example. Another example would be, let's see, actually the kindergarten readiness. So recognizing letters entering kindergarten, that's a measure that we add in on the back end on our own, as well as 3rd grade reading proficiency. Those are examples of that. So we're currently working to add the point in time count for homelessness within the region. And we're also working with Central Oregon Intergovernmental Council to add a number of different transportation measures, particularly how public transportation and access to things like grocery stores and basic necessities are available based on the communities that people live in our region. So those are just a few examples.
Thank you. I have another question for you, and this is a bit of a curveball, so it's okay if you're not prepared to answer this right now. With the racism as a public health crisis bill that is being considered right now for Oregon, there is an element included regarding real D data, which is race, ethnicity, language, and disability. And I'm curious how that can impact the breadth of data that we have on the site in the future and the ability to break down by demographics.
Is that for me to answer, Kelsey?
Yeah, you go for it.
That's a fantastic question. I think that we are always striving to make our data more complete and inclusive and equitable wherever we can. And so having data that looks at a different health topic through a variety of different lenses can only improve and help make us make more informed and equitable decisions. And so we're hoping that as we proceed and move forward, that those different lenses of data will be added in when it's available to us.
Kara or Shanna or Sarah, did you want to add anything about that?
I mean, equity data is something we're going to keep striving for. 100% agree with everything Rebecca said. I would add that if you are looking for some of that data currently, some of it does exist on the site. So information around the population over 5 years of age who speak a language other than English at home is on the site. We have a multitude of metrics around ability and disability. Information around linguistic isolation is on the site. So yes, we definitely need to keep working on it. But if you are trying to get data now around those requirements, please check out what's already on there and see if it can help.
And at our company, we have an internal task force based on health equity who is always searching for more national and state data sources that are collecting that sort of information or providing more data with subgroup breakouts where we can see that. Unfortunately, we're only as good as the data collected. So as more organizations become aware of this need, it will start to trickle down. We'll be able to show more of that.
Thank you, Kara. That seems like a great place to stop. We are at 2:58. Thank you all so much for coming today. I'll hand it back to you, Lisa, if you have any closing comments.
Yes, I would like to say thanks again to Rebecca, Sarah, Channa, Kara, and Kelsey. I know I learned a lot more about the site, even though I have spent some time with it. So that's great. And I think there's even more data added than the last time I was there. So I also want to thank everybody for joining us today. And I'd just like to send you off and say, have a great day.